COVID-19. Coronavirus cause respiratory infections, ranging from common cold to severe diseases like SARS and MERS. SARS stands for Severe Acute Respiratory Syndrome, and MERS stand for Middle East Respiratory Syndrome. SARS outbreak was seen in 2002, while MERS outbreak was seen in 2012. COVID-19 is an infectious disease, similar to SARS, and caused by virus SARS-CoV-2. This new disease and virus were unknown before outbreak began in Wuhan, China, in December 2019. COVID-19 is a pandemic that affects people globally. Researchers say that human coronavirus is 96.2% genetically similar to bat coronavirus. Types. SARS-CoV-2 is assumed to have two types, S-type and L-type. S-type is seen in 30% of cases, while L-type is seen in 70% cases. The infection caused by S-type is less severe and aggressive in comparison to L-type. While S-type is assumed to be originated from an animal, the L-type is thought to be mutated from S-type virus. The virus can be transmitted by respiratory droplets, while sneezing or coughing, and can be viable for 3 hours after forming aerosolized droplets. These droplets can travel more than 25 feet in less than a second. It can also be transmitted by fecal-oral route. As the transmission is rapid, it is important for people to maintain hygiene, wear masks and gloves, wash hands after touching surfaces, avoid contact with people, avoid going in crowds, staying home, and having proper self-care. Viability. All viruses have a period till which they are viable to infect a person. SARS-CoV-2 is known to be viable for 8 hours on latex, aluminum, and copper. It can stay viable for 24 hours on cardboard, and for 1 to 3 days on countertops, stainless steel, and plastic. It is also known to be viable for 5 days on glass and wooden surfaces. Symptoms includes fever, cough, shortness of breath, difficulty in breathing, chills, repeated shaking with chills, muscle pain, sore throat, headache, and new loss of taste or smell. These symptoms develop due to severe lung damage, which can cause ARDS, that is acute respiratory distress syndrome. ARDS occurs when the fluid builds up, in, and around the lungs. This can cause septic shock, which simply means that the infection is causing organ failure, and dangerously low blood pressure. This septic shock and ARDS are the main cause of deaths. Once a person is infected, the symptoms develop 5 days later. This is known as the incubation period. All viruses have an R0 value. R0 is the reproductive number of a virus. It represents how quickly can a virus spread. If R0 value of a virus is 1, then an infected person can pass on the virus to 1 new person. If the R0 is 2, then it can be passed on to 2 new people, and so on. The R0 of SARS-CoV-2 is approximately 2.2. Diagnosis. It includes different procedures like RT-PCR, that is, reverse transcription, polymerase chain reaction. It is used to detect small amounts of viral RNA. Chest CT is performed in the cases of severe pulmonary disease suspects. Isothermal amplification is used to detect viral RNA in minutes. Rapid serological testing. Also, differential diagnosis should be ruled out. Treatment. For mild symptoms, isolation at home should be done to get rest, and fluids are prescribed. For severe cases, supportive care is given, like fluids, oxygen supplements, and ventilatory support. Some data show remdesivir, an antiviral drug, which was previously used for Ebola, to be helpful. Other researches done are lopinavir and ritonavir. Both antiviral drugs were used to try to treat COVID-19. Chloroquine and hydroxychloroquine were also used, but they are usually used to treat malaria. Hydroxychloroquine and azithromycin, when used together to treat COVID-19, showed to be effective in one trial. Researchers are developing vaccines in countries around the world, and it is estimated to be developed by 2021.